Thank you so much for being here today. My name is Janan. Today I will talk to you about AI Precise, which is an artificial intelligence-based software which predicts how well patients respond to their chemotherapy treatments. This is our multidisciplinary team consisting of experts in artificial intelligence, mathematics, statistics, cancer research, as well as business development. In addition to being a multi-talented team, we are a bunch of individuals who are passionate about automating current clinical processes. Our goal is to improve cancer recovery time by personalizing treatments to suit each patient's body needs. Unfortunately, 50% of you watching this video will at some point in your lives have cancer. That means you will need chemotherapy. How patients respond to chemotherapeutic treatments is highly variable, with some patients having adverse drug reactions, some being okay, and some having a lack of response, which means that the cancer continues to grow and spread. When determining the best treatment protocol, clinicians rely on these imaging modalities called CT scans, which are cross-sectional scans of the human body. They look at the distribution of fat within these scans because the current assumption is the more fat you have, the more likely you are going to have adverse drug reactions. There is a lot of guesswork involved in the process, and this guesswork does come with a price. 35 to 40% of patients do not respond to their treatment in the way that is expected. So this one-dose-fits-all approach is not working. There is a real need to create a technology that will predict how well or how poorly patients respond to their treatments. Now, this is where AI Precise comes in. You are probably thinking, well, hasn't anyone looked into this previously? And the answer is, well, not really. On the left-hand side of the screen, you'll see the current software available, Slicematic. There are several issues with using Slicematic. It's a research-only tool. It has a very complicated user interface. To get the information about the fat distribution, the clinician has to do a lot of manual work, and this can take anywhere between 18 to 45 minutes per image. There's also no predictive dosing, and Slicematic only looks at 2D analyses. Now, if you compare that to our software on the right-hand side, you'll see a nice, clean, crisp user interface. Everything is done automated with the click of a button, and it only takes 25 seconds per image to extract all the relevant information. And this information is used to predict the right chemotherapy at the right dose. Our software also includes 2D and 3D analyses. Now, when comparing the softwares in terms of how many patients can be seen per day, with Slicematic, you can see at most 8 patients, whereas with AI Precise, over 100 patients, because it is 100 times faster. We've incorporated 3D modeling because the two-dimensional information is not really intuitive to describe what's happening throughout the body. Our 3D model allows clinicians to interactively assess the distribution of fat throughout the whole body to give a better estimate of how patients are going to respond to their treatments. While we have used the 3D model for cancer therapy, future iterations of the model can be applied to other areas of medicine. For example, looking at bone densities in osteoporosis cases. We've combined all of this information into an automated report. So the 2D and 3D analysis basically predicts which chemotherapy and which dose will be the best for the patient. So not only have we made the patient's lives easier, we have made the clinician's lives easier. There are several benefits to using our software. It improves the patient's quality of life, improves cancer recovery time, and it minimizes the amount of time the patient is readmitted back to hospital. Clinicians save time, they can see more patients, and the hospital also saves on costs because there's a time efficiency and also minimization in terms of readmissions. The current market size is $180 billion for the chemotherapeutic area, and there's a compounded annual growth rate of 7.7%. In terms of who will pay for the product, that'll be the hospital administrators. And the model we've used is the subscription model service. So in exchange for a monthly fee, not only do the clinicians have access to software, but they'll also have access to customer service, technical support, along with training materials. This is our development timeline. The 2D, 3D component has been finalized. The automated report is on the cusp of being finalized. And the next step is to conduct a randomized control trial in which we compare our AI product to the current treatment protocols. And then we'll use all of this information to register the software with the Therapeutics Good Australia. Now, in terms of opportunities to collaborate, if you are an investor, we do need some help and funding to get our randomized control trial off the ground. Alternatively, if you'd like to share some data or if you think we can help you with our software, please reach out to us. Here are my contact details, both email, Twitter, and LinkedIn. And any other questions, I look forward to hearing from you. Thank you so much for your time.